Hi, Mark,
Brian.
and we're not too wild and crazy guys this month because that was last month. So, what we want to talk about today is knee pain a little bit, okay? But here's where I'm going with this. What we see a lot of times, and what we want you to understand, is that where a person has symptoms does not necessarily mean that's where the problem is. So I'm going to use the knee for an example this month, okay? Now, in our clinic here, Brian and I, if we get knee pain, we very rarely treat the knee. Now, this is if it's non-traumatic and this is just an overuse injury, or people just start presenting with knee pain from running too much or doing something. What we typically get told is that the patient is told, you have knee pain, doctor looks at the knee, says you need to strengthen your knee. What we have found is, I haven't seen anybody with a weak knee, or meaning the quadricep muscles, because they're overused. Where I'm going with this, a lot of times knee problem is a hip or a foot and ankle problem. So what I want to address this month in our videos is a couple of different things to look at that could be causing the knee pain. So the knee is just stuck in the middle. Okay, it's like a car on the railroad tracks. The knee can only go where your hip or your foot and ankle will let it go. So it's kind of stuck, but it can take the brunt of it simply because it's not being controlled by those other two structures. So we're going to talk about that, give you a few suggestions on that this month. So if you have further questions, contact us at fitness4lifept.com.